Hi, I greet you again today, and we are continuing with the series on arthritis cure. As I said before, that you'll find that arthritis is becoming a very common affliction, especially amongst those who are aged, say between 40 and above. And there are over 100 different types of arthritis, and all arthritis have different causes, root causes, and each one's arthritis has a different set of causes. That's why you cannot design a magic bullet, something which you'll swallow at once and it clears your problem. And also you'll find that in arthritis, bones are deformed. Some of the joint materials, the cartilage and other things, the synovium membrane, they are destroyed. Therefore, you should not expect that you swallow something and in the morning you wake up, your bones have grown and all your joint tissues have repaired. Healing is a process, and healing takes time. And you have to be, basically, if you have intention to heal, you should have faith, you should have hope, and you should have belief in the healing process. If you doubt, then basically healing is halted. We are told that it is done to you based on your belief, and you should believe in the healing process. So today I'm going to cover a topic called obesity and arthritis. I've discovered that most people who are suffering from osteoarthritis are also obese. And it is most unfortunate that the society expects people at the age 40 and above to be obese, because obese symbolizes prosperity and wealth. So most people would like to have big bellies, the wazes, so that they are told that they are wealthy. And I've come across men who don't want their wives to lose weight. He has an obese wife, and the wife has arthritis, diabetes, high blood pressure. You give an advice that your wife should lose this weight. You calculate the BMI. You find this lady is obese class. In fact, there's no calculation, it's above. So if you give advice that the wife should lose weight, you find the husband refuses. He says, what will people say? What will the society say? People say I'm starving my wife. That is why my wife looks slim. She has lost weight. In the society, it signifies that the wife is being given problems in the household. And the husband on the other side also does not want to lose his tummy. He says that tummy, people say, he is a wealthy man, and it's a symbol in the society of wealth. And the wife being obese is a symbol that the husband is taking good care of the wife. Now, when you start looking at this kind of thinking and beliefs, it becomes very difficult to deal with arthritis, because you'll find that the normal treatments we get in the hospitals, basically you'll be given painkillers to kill your pain, and basically steroids to suppress the inflammation and also give you pain relief. Now, if you give this to an obese person, whereby that obesity, that extra baggage, is the one that is damaging the weight-bearing joints, like the knees and the spine at the back, the lower back, sorry. So you'll find that actually these people, is that weight, it is the one that is causing the wear and tear. Osteoarthritis is a wear and tear disease. In other words, the joints, the cartilage within the joint are rubbing on each other, and possibly also there's no adequate synovial fluid to lubricate them so they can become smooth. So you'll find that the bones will rub on each other. So the more weight you have, the more the chances that your joints will rub against one another and will damage your articular cartilage and the tissues within your joints. So in this case, you don't look for a magic bullet. You want something you swallow by tomorrow or a week. The arthritis is gone and the obesity is still there. It is impractical. So if you want to cure your arthritis, especially those who have osteoarthritis, the first thing is to lose weight, and there's no bargain about it. There's no bargain about it. There's no cure. You can't get any cure. Many people want to get cured. They're obese. If you talk about the weight, they say no. You focus on the joint. It is impossible. It is your weight which is causing your problem. And I would say that actually, when you develop osteoarthritis, the first prime focus should be your weight. And your weight basically, it's your lifestyle. You check what kind of foods are you eating. There are foods which have high caloric value. And if you eat these foods, you're going to increase fat in your body and you're going to gain weight unnecessarily. Similarly, there are also women who use, who are on, family planning pills. They also become obese because of the hormonal interferences. So you'll find also women who gain weight, and also there are women who, after giving delivery, they gain weight. But all in all, there is something known as the BMI, body mass index. This is a simple calculation which you can be taught. You can have a BMI calculator. It's on Google Play. You can download it. You just input your weight, your height, and your age, and you know where you fall. Are you within the normal? Are you overweight? Are you obese 1, obese 2, obese 3 plus? And based on that, you can be able to control your weight and control the wear and tear of your joints. So osteoarthritis can be prevented. It can be halted and it can be reversed by controlling your mouth, the things you're putting in your mouth. Before you put something in your mouth, ask yourself, did this thing have roots? Did it grow on the soil? If the thing never grew on the soil, then it's unnatural. And especially if it contains refined sugar, that thing is going to spike your weight. And soon you'll be crying about your joints. So you created it. We create obesity. Then as we age, that extra baggage, you find that as our system starts slowing down, even the rate of repair of the cartilage, you find that with your excess baggage, the rate of repair of the cartilage during your daily motions, like walking here and there, you find that the rate at which the cartilage is being damaged is higher than the rate at which your body is repairing the cartilage. Possibly you're not eating the correct foods that can supply material. You need glucosamine and other things to help prepare the cartilage in your legs. So if you're not consuming the right foods and you're gaining weight, eating junk food, my friend, you have a problem. You have to have osteoarthritis. This is osteoarthritis, not rheumatoid. So in this video, I'm focusing on those with osteoarthritis. I would like those with osteoarthritis to focus on reducing the weight and going to the normal. In fact, even the other types of arthritis, when you take painkillers and you're consuming sodas, if a bottle of soda possibly has about 10 teaspoons of refined sugar, which is going to be converted into fat, you're consuming a liter per day. How much fat are you entering your body? Healing is spontaneous. You have to know your body. It's just like your car. You know when you're supposed to service your car, what kind of fuel you should put in your car, when you should do various things to your car, so that you make sure that your car is always in perfect order. But most people look after their cars much better than their bodies. Your bodies, you put in alcohol 24/7. You're damaging your body. You're not eating. You're damaging your body. You're damaging your systems, your immune system, the healing system. You're not giving it a chance to do its work. So, from today onwards, kindly prevent, halt, or reverse your arthritis. Even if you have arthritis today, you can reverse it. If you're obese class 3 and you have osteoarthritis, why don't you reduce it? Go to obese 2. Progressively move to obese 1. Progressively go to overweight. Progressively, you'll enter the normal range. And what's going to happen? You're going to become lighter to your joints. And when you become lighter to your joints, and with the correct nutritional diet, you will nurture your damaged cartilage, and your body is capable of repairing them. It knows your body made the cartilage in the first place, and it has been repairing. It knows how to do it. You don't have to train it. It has not lost its knowledge on how to repair and make cartilage in your joints. It is you who is sinning. It's you who's giving your body a lot of weight, a lot of unnecessary strain, so that your joints rub on each other, take painkillers, and mess them even further. Continue with your lifestyle at the mercy of your joints, and you damage the bones. At the end of the day, those bones, it will take you time for those bones to grow back if the damage is irreversible. If it is not, then your body will try to heal itself as best as it can. So, if you like these videos, I kindly request you to like this video and also subscribe to our channel. The subscription is free. There's a bell on YouTube clip. Just click it. Once you click the YouTube bell to subscribe, basically what it means, you'll be notified. Anytime I release a new video, you'll get a notification on your phone that a new video is out, so that you can be able to see it, so that you can be able to transform your life and your health, so that you become more healthy. I've been releasing some videos, and to ask me when I'm releasing the next, they don't know when I'm releasing the next one, but I've released it. It's already in the channel. So when you subscribe, you'll be getting updates. Thank you very much.